السلام عليكم، معكم شفق ميديكال مختصين بالعلاج في تركيا. تشاهدون اليوم الحلقة الرابعة من السلسلة الأسبوعية الشيقة مع البروفيسور التركي علي زرع الخبير في علاج الباركنسون والاضطرابات الحركية. في هذه الحلقة تشاهدون قصة المريض الروماني جيكو صاحدك من خلال مقابلتنا معه، حيث أجرى عملية التحفيز العميق للدماغ، كونه عاش معاناة مع الباركنسون لمدة دامت 13 سنة. تشاهدون كذلك مراحل العملية بالتوثيق من طرف قناة CNN تركيا، والمريض يغني أثناء العملية ويحادث زوجته من خلال الهاتف، وينصح المرضى آخرين بإجراء العملية للقضاء على الباركنسون وهو في أثنائها. نترككم الآن للمشاهدة.
Yes, my name is Jiku Sahidak. I came from Romania. I am a mechanical engineer and I have 56 years old.
For the Parkinson disease,
Yes.
how did it start with you?
It started in 2007, and in time this disease increased its side effect. Yes, I take medication.
Yeah.
It's, the main important medication is levodopa.
Okay.
Yes, and I took it. The last quantity of this medication was 6 pills per day. 6 pills.
6 pills per
Yeah. It was the limit, the high limit.
Yes.
And I decided this was time for such surgery.
Yes. Why did you choose Turkey and not Romania?
Because Romania is not performant.
It's not performing compared to Turkey.
No, not yet. Perhaps in the future will be, but now, right now, it's not.
Yes. How did you choose? How did you get into contact with Palmer or with?
I find the information on the internet.
Yes.
Yes, and it was simple. First I put some question in a form, electronic form, and somebody answered to me, and we start a conversation in the beginning of the year. And in the beginning of the year, I learned that this operation cost. I didn't have the money, and I started to raising
Yes.
donations, help for friends, for family, for friends,
Yes.
and that took half year. Half year, yes. And after I got all the money, I started to discuss the final preparation with the team here. Yes.
So, before performing the DBS surgery, what were your expectations comparing to the result you are having after DBS?
It will be curious that the expectation and the results were the same. Were the same, yes.
Perfect.
Because I have realistic expectations, and this is what I get.
Perfect. So currently, are you taking any medications?
Right now, yes, I have a medication, but not the same like before.
Not same.
It's a different one.
Yes.
Of course, I don't take anymore this kind of levodopa, the main medication that stop this the tremor. Yes.
So for the DBS surgery,
Yes.
how much time did you stay during the surgery?
How long it take the operation itself?
Yes. During surgery, how much it was?
About 3 hours.
3 hours. And is it for the anesthesia? Was it local anesthesia or general anesthesia?
You see, was a two-part operation. First part was without anesthesia, because it was on the brain to make it whole, to put the electrodes,
Yes.
and to check if it is the right position.
Local
Local, yes, it was because it was anesthesia on the skin of the skull,
Exactly.
because it was a frame, metallic frame.
Yeah.
They were mounted on my head,
Yes.
and with some screws,
Yes.
and where the screws make contact with my skull, it was local anesthesia.
Yes.
Yes.
Have you felt any pain during surgery?
No. In the first part, how I said, it was the local anesthesia on the skin on my skull to put the frame. After that part of operation was finished, it was a general anesthesia, and I fall asleep and after when I wake up, I found all the parts here were finished. The cable were here. The battery was mounted without feel anything.
And for the battery,
Yes.
and for the battery, is it a rechargeable battery or?
Yes, it's normal. It is a chargeable battery. And the battery is placed in this area under the skin, and he is charged wireless.
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 Perfect. And for the tremor, comparing for the tremor,
Yes. Yeah.
before the surgery and right now, how do you see that?
It is improvement, 80% improvement.
80% better.
Yes.
Amazing.
Yes, but the most important part of improvement caused by this operation, it is my walking.
Perfect.
Before I was almost blocked.
You did not manage to walk.
Yes, it was very difficult to walk. And after that, I can walk steadily. No problem. No, but with some small difficulties in walking, but not big problem. But the improvement is huge in walking.
Amazing.
Yes.
So this is for the DBS.
Yes.
And how much you stayed here in Turkey?
I will stay here in 1 month.
You stayed 1 month.
Yes. So let's say 5 weeks.
5.
Almost. Yes. 5 weeks.
Almost 5 weeks.
Yes.
And after you returned to your country,
Yes.
did you have, for example, any complications or something?
No.
You have no.
No. Fortunately, no. But it is realistic to say this kind of operation, it is depending on the age of the patient. It is not a zero risk operation.
Certainly.
No. It can be it has some risk, but you must to accept this.
Exactly.
Yes.
Before performing the surgery,
Yes.
did the professor communicate with you the success rate of this surgery?
Yes. Not on the time, but it was written on this some form from some papers. Did I sign it?
Yes.
Or where that it could be complication. Could be. It's not so. Mr. Professor gave me a bigger chance
Yes.
to recovery and not to have complication. Yes, I am also big thank you for all the team and all the people there. It was very nice and very kind with me and very helpful. Yes, they will help me a lot. I have no words to say thank you. Yes, I recommend to the people that have the same problems with me, I recommend warming and to have confidence that it's not a very complicated operation. It's a little bit courage you must have. You must have. But if somebody has problem like me, can try it and you will be not disappointed. I'm sure for that.
56 yaşındaki Romanyalı hasta 13 yıldır mücadele ettiği hastalığın şiddeti artınca beyin pili taktırmaya karar verdi. Türkiye'de narkozsuz ve hasta uyanıkken yapılan ameliyatta kameralara ilginç görüntüler yansıdı.
Say goodbye. Let me try, let me try.
Sizin seyrettiğiniz ameliyat beyin pili takılması ameliyatı.
Şarkı söyledi, eşiyle görüntülü konuştu. Üstelik bunların hepsini beyin ameliyatı sırasında yaptı.
Let me try, let me try. I don't understand.
Romanya'da yaşayan makine mühendisi Gicu Sadeç, 43 yaşındayken sol elinde bir titreme hissetti. Yapılan tetkikler sonucu Sadeç'e Parkinson teşhisi konuldu. Hastalıkla 13 yıl boyunca mücadele eden Rumen mühendisin ağrıları ve titremeleri artınca tedavisi için beyin pili takılmasına karar verildi.
Biraz minicik, çok minicik.
Türkiye'de ameliyata alınan Sadeç'in operasyonu narkozsuz bir şekilde gerçekleşti. Romanyalı hasta ameliyat sırasında Let Me Try, Bırak Tekrar Deneyim adlı şarkıyı söyledi.
Let me try, let me try. I don't want to say goodbye. Let me try, let me try.
Eşiyle telefonda görüntülü görüşme yaptı.
Operație a fost totul ok.
Hatta Parkinson hastalarına tavsiyede dahi bulundu.
I don't feel pain right now. I recommend to people that have such disease to make this operation because it's not so difficult. The most important part is to be confident of them and not to be scared.
Operatör doktor Ali Zırh operasyonun tamamen acısız ve narkozsuz şekilde yapılabileceğini söyledi.
Yaptığımız işlem beynin içerisine 2 küçük ince elektrot koyup birer uzatma kablosuyla göğüste kalp pili gibi cilt altına yerleştirdiğimiz bir pile bağlamak. Ameliyatta da birer küçük delik delerken cildi uyuşturuyoruz. Bunun dışındaki kısım ağrısız, karşılıklı sohbet ederek geçiyor.
Zırh tedavi sayesinde Parkinson hastalarında büyük oranda iyileşme kaydedildiğini de belirtti.
Yaklaşık 10 yıllık bir hastayı biz ameliyat ettiğimizde hastalığın 1. 2. senesindeki haline geriye getirebiliyoruz.